All right, let's talk about knee injuries. We're going to break down two of the most common ones you hear about, ACL and meniscus tears. We'll cover everything, from what they are to the signs that you need help, and all the way through the full road to recovery.
You know that sound, right? That dreaded, sharp pop in your knee. It's a sound athletes and really anyone who's active just fears. And for good reason. It's often the first signal that something serious just happened. It can be the moment everything changes. And look, this isn't just something that happens to pro athletes. This can happen to any of us. It's usually in those split-second movements, a sudden stop on the basketball court, landing a jump just a little bit off, or even just twisting the wrong way during your weekend hike. Okay, so what is actually happening inside your knee when you feel that? To really get it, we need to decode the damage and look at the two main culprits here. So this really breaks it down nicely. Think of the ACL, that's the anterior cruciate ligament, as the main stabilizing rope inside your knee. When that tears, you get that awful feeling of the knee just giving way. Then you've got the meniscus. That's your shock absorber, the cushion. Tearing that is what often leads to pain, stiffness, or that weird locking sensation. Now, you might be tempted to just walk it off, right? To just tough it out. But here's the deal. Ignoring these injuries is a huge gamble. The key thing to understand is that untreated tears can seriously ramp up your risk for problems down the road, like long-term arthritis and more damage to the joint. So how do you know if it's serious? Serious enough to actually go see a doctor? Well, your body gives you some pretty clear signals. You just have to listen. So let's run through the checklist. Did you hear that pop we talked about? Was it followed by immediate, pretty significant swelling? Does your knee feel wobbly or unstable, like it could just buckle underneath you? If you're having trouble bending or straightening it all the way, or if it feels like it's catching or locking up, those are major red flags. All right, so you've decided to get it checked out. What happens next? What's the game plan? Well, there's a pretty clear playbook for getting you back on your feet. The journey almost always starts with getting a clear picture of the damage, usually with something like an MRI. From there, the path can split. It might involve non-surgical care, or, for the more serious stuff, surgery. And no matter what, it's always followed by a really structured rehab program. And this brings up a huge question that pretty much everyone asks, and it's a really good one. Do you have to get surgery? The answer might actually surprise you. And the answer is no, not always. For a lot of smaller tears, a more conservative approach works wonders. Physiotherapy is huge here. The goal is to strengthen all the muscles around the knee, your quads, your hamstrings. They basically form a muscle brace that supports the joint and helps make up for the injury. But for those bigger tears, the ones that cause major instability, surgery is often the best path forward. The great thing is that modern techniques are usually arthroscopic, which means surgeons use a tiny camera and tools through small incisions. This is how they do things like ACL reconstruction or repairing the meniscus, all to get that long-term stability back. Getting the surgery or the initial treatment is one thing. It fixes the broken part. But the real work, the most critical phase of the whole journey, that's the recovery. This is the question on everyone's mind, right? The whole reason you go through all of this. Will I get back to doing what I love? And the answer, thankfully, is a resounding yes. A serious knee injury does not have to be the end of your active life. With a dedicated, proper rehab program, the vast majority of people get back to playing their sports and enjoying all their high-level activities. So what are we talking about time-wise? Well, for something like an ACL reconstruction, you're generally looking at a 6 to 9 month commitment to rehab before you can safely return to those high-impact sports. It's a marathon, not a sprint. And this is so important to get. Recovery isn't just physical. It's not just about lifting weights and doing exercises. It's also a huge mental game. It's about rebuilding that trust in your own body and getting back the confidence to plant your foot, to pivot, to jump, and to move without being afraid. Look, a serious knee injury can feel totally devastating, like a massive setback, but it is not a dead end. With the right diagnosis, a clear plan, and a real commitment to your rehab, the path back to a full, active life is absolutely within your reach.